On January 23, 2020, China locked down 3 cities at the epicenter of a new coronavirus outbreak that has killed 17 people and infected at least 634, as health authorities around the world took action to prevent a global pandemic. Health officials fear the transmission rate will accelerate as hundreds of millions of Chinese travel at home and abroad during week-long holidays for the Lunar New Year, which begins on Saturday, January 25, 2020. However, it is already too little, too late. Since the newly identified coronavirus has already spread across the world. Cases have also been confirmed in the US, the UK, Taiwan, South Korea, Thailand, Japan, Hong Kong, Vietnam and Singapore. Singapore confirmed its first case, the new coronavirus, with the Ministry of Health, MO, saying the patient was a 66-year-old man from Wuhan who arrived in Singapore with his family on Monday, January 20, 2020. A Chinese man living in Ho Chi Minh City was infected by his father, who traveled to Vietnam on January 13, 2020, from the Chinese city of Wuhan. On January 23, 2020, a nurse working at a hospital in Saudi Arabia is the first Indian to be infected by the coronavirus. Cases of COVID-19 first emerged in December 2019 when a mysterious illness was reported in Wuhan, China. The cause of the disease was soon confirmed as a new kind of coronavirus, and the infection has spread to a number of countries around the world. The strain is traced to a seafood market in the city, which is quickly shut down. Some 40 people are initially reported to be infected. On January 8, 2020, Chinese researchers say they have identified a new virus behind an illness that has infected dozens of people across Asia, setting off fears in a region that was struck by a deadly epidemic 17 years ago. There is no evidence that the new virus is readily spread by humans, which would make it particularly dangerous, and it has not been tied to any deaths. But health officials in China and elsewhere are watching it carefully to ensure that the outbreak does not develop into something more severe. Researchers in China have initially identified the new virus, a coronavirus, as the pathogen behind a mysterious, pneumonia-like illness that has sickened 59 people in the city of Wuhan and caused a panic in the central Chinese region, the state broadcaster, China Central Television, said on Thursday, January 9, 2020. They detected this virus in 15 of the people who fell ill, the report said. The new coronavirus is different from previous human coronaviruses that were previously discovered, and more scientific research is needed for further understanding, the report said. China initially covered up the extent of the SARS outbreak and was criticized by health officials around the world for doing so. On Thursday, January 9, 2020, the World Health Organization praised the Chinese response to the new outbreak and said it did not recommend any restrictions on trade or travel to China because of the virus. The Wuhan government confirmed on December 31, 2019, that the health authorities were treating dozens of cases of pneumonia of unknown cause. Symptoms of the new illness include high fever, difficulty breathing and lung lesions, according to the Wuhan Health Commission. 7 people have become critically ill, the Wuhan authorities have said. The initial cases were linked to workers at a market that sold live fish, animals and birds. Workers disinfected and shut down the market after the city health department said many of the cases had been traced to it. The virus is believed to have jumped to humans from live animal markets. It was eventually traced to civet cats, raccoon dogs and some other species that were raised and slaughtered for the exotic food trade. The virus normally circulates in bats, and the animals may have gotten it from them, possibly by eating food contaminated by bat droppings. The new illness appeared just weeks before the Spring Festival, China's biggest holiday, when hundreds of millions of people travel. The authorities have urged the public to be on alert for pneumonia-like symptoms like fevers, body aches and breathing difficulties. Until Thursday, January 9, 2020, it was not clear what was causing the illnesses in Wuhan. The World Health Organization said Wednesday, January 8, 2020, that it had concluded that it was most likely a coronavirus. More comprehensive information is required to confirm the pathogen, the WHO said in a statement. Early reports on PROMD, a disease alert service, said there was no evidence of human-to-human transmission. Health officials in Asia have stepped up screenings and isolated patients with flu-like symptoms who had traveled to Wuhan. In Hong Kong, 8 people with fever and respiratory symptoms who had recently been in Wuhan were hospitalized on Wednesday, January 8, 2020. In South Korea, the authorities said on Wednesday, January 8, 2020, that they had put a Chinese woman under isolated treatment after she was found to have pneumonia after trips to China, including Wuhan. In Singapore, the authorities placed a Chinese girl with pneumonia in isolation because she had traveled to Wuhan. On Sunday, January 5, 2020, they said doctors had determined that the child had a common childhood viral illness. A novel coronavirus, identified by Chinese authorities on January 7, 2020 and currently named 2019 CoV, is a new strain that had not been previously identified in humans. On February 11, 2020, the World Health Organization announced that the official name would be COVID-19, a shortened version of coronavirus disease 2019. The WHO refers to the specific virus that causes this disease as the COVID-19 virus. The International Committee on Taxonomy of Viruses calls it the Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2, because it is related to the virus that caused the SARS outbreak in 2003. However, to avoid confusion with SARS, the WHO calls it the COVID-19 virus when communicating with the public. Genetic analysis of SARS-CoV-2 sequences shows that their closest genetic relatives appear to be bat coronaviruses, with the role of intermediate species possibly played by the pangolin, an endangered species trafficked in China for its scales and meat. While it isn't necessarily a cause for worry, there is another virus that commonly emerges from animal reservoirs: influenza. Almost all known influenza viruses originate in waterfowl, such as ducks, geese, terns, gulls, and related species. Many viruses move from birds into other species, including humans. Often, the new species is a dead end. The avian influenza virus can jump from birds to humans, for instance, but not between humans. But occasionally, a novel virus can also spread efficiently among people. We saw this most recently in 2009 with H1N1, a swine virus that spread among humans, eventually causing a pandemic. And an avian H1N1 virus was responsible for the global pandemic of 1918. The role of intermediate species may also be more complex than scientists thought at first. Researchers initially suspected that such species were necessary for coronaviruses to move from the primary reservoir species into humans. Perhaps the virus evolved and adapted to the intermediate species, making it more efficient at binding to human cells. However, recent studies have shown that some bat coronaviruses can infect human cells without passing through an intermediate host, meaning a significant reservoir of undiscovered coronaviruses may lurk out there. Scientists say the new coronavirus may be significantly different from SARS. The new coronavirus has an HIV-like mutation that means its ability to bind with human cells could be up to 1,000 times as strong as the SARS virus, according to new research by scientists in China and Europe. The discovery could help to explain not only how the infection has spread, but also where it came from and how best to fight it. Other highly contagious viruses, including HIV and Ebola, target an enzyme called furin, which works as a protein activator in the human body. Meanwhile, a study by French scientist Étienne Decroly at Aix-Marseille University, which was published in the scientific journal Antiviral Research on February 10, also found a furin-like cleavage site that is absent in similar coronaviruses. Chinese researchers said drugs targeting the furin enzyme could have the potential to hinder the virus's replication in the human body. These include a series of HIV-1 therapeutic drugs such as indinavir, tenofovir alafenamide, tenofovir disoproxil and dolutegravir, and hepatitis C therapeutic drugs, including boceprevir and telaprevir. This suggestion is in line with reports by some Chinese doctors who self-administered HIV drugs after testing positive for the new coronavirus, but there is as yet no clinical evidence to support the theory. Coronavirus is spread primarily through tiny droplets coughed or sneezed directly from an infected person into the face of someone nearby, as opposed to the more contagious airborne transmission of a virus like measles, which can remain suspended in enclosed spaces and be breathed in hours after being exhaled by sick individuals, experts say. A naked virus can't go anywhere unless it's hitching a ride with a droplet of mucus or saliva, said Qin On Kwok, a professor at the Chinese University of Hong Kong's Jockey Club School of Public Health and Primary Care. These mucus and saliva droplets are ejected from the mouth or nose as we cough, sneeze, laugh, sing, breathe and talk. If they don't hit something along the way, they typically land on the floor or ground. To get access to your cells, the viral droplets must enter through the eyes, nose or mouth. Some experts believe that sneezing and coughing are likely the primary forms of transmission. Professor Kwok said talking face-to-face or sharing a meal with someone could pose a risk. Coronavirus can also survive on surfaces, such as handrails and doorknobs, for a very long period of time and be picked up by hand that way, though the virus is very susceptible to cleaning products. A study of other coronaviruses found they remained on metal, glass and plastic for 2 hours to 9 days. Coronaviruses are relatively easy to destroy, Professor Whitaker said. Using a simple disinfectant on a surface is nearly guaranteed to break the delicate envelope that surrounds the tiny microbe, rendering it harmless. A delicate but highly contagious virus, roughly 1/900th the width of a human hair, is spreading from person to person around the world. Whether the coronavirus that's quickly spreading around the world will follow the flu season and subside with spring's arrival is unsatisfyingly uncertain, and many scientists say it's too soon to know how the dangerous virus will behave in warmer weather. Viruses that cause influenza or milder coronavirus colds do tend to subside in warmer months because these types of viruses have what scientists refer to as seasonality. But it's highly uncertain that SARS-CoV-2 will behave the same way. Those currently studying the disease say their research is too early to predict how the virus will respond to changing weather. Research about why some viruses are seasonal has been largely centered around those that cause the flu, a disease long associated with winter months. Flu season generally lasts from October to April or March. Scientists have a number of theories for why that is. Some suggest it's closer quarters to escape the cold weather, people cluster indoors, where human-to-human transmission becomes more likely. To understand why northern latitudes see an uptick in flu cases during winter, researchers have looked at how the virus spreads in different temperature and humidity levels. And relatively recent research suggests that dry cold air may also help viruses stay intact in the air or travel farther as they become airborne. One of the first studies to test how environmental conditions affect viral transmission was published in 2007, and it looked at how influenza spread through guinea pigs infected in a lab. High temperatures and in particular high humidity slowed the influenza spread, and at very high humidity levels, the virus stopped spreading completely. Warmer air holds more moisture, which prevents airborne viruses from traveling as far as they would in dry air. In humid conditions, the small liquid droplets in a cough or sneeze gather more moisture as they're expelled. Eventually too heavy to stay airborne, they drop to the ground. Studies outside the lab show similar results, though some tropical regions have more cases of flu during rainy season, when people also cluster indoors. Scientists hypothesize that low humidity, which often occurs in winter, might impair the function of the mucus in your nose, which your body uses to trap and expel foreign bodies like viruses or bacteria. Cold, dry air can make that normally gooey mucus drier and less efficient at trapping a virus. Ian Lipkin, director of the Columbia University's Center for Infection and Immunity, has been studying the novel coronavirus. He says sunlight, which is less abundant in winter, can also help break down viruses that have been transmitted to surfaces. Hong Kong University pathology professor John Nichols said that he suspected 3 factors would potentially kill the virus, according to the transcript of a private conference call. 3 things the virus does not like. 1. Sunlight, 2. Temperature, and 3. Humidity, Nichols said in remarks that were leaked on social media. The virus can remain intact at 4 degrees, 39 degrees Fahrenheit, or 10 degrees, 50 Fahrenheit, but at 30 degrees, 86 degrees Fahrenheit, then you get inactivation. Chinese health authorities are still trying to determine the origin of the virus, which they say came from a seafood market in Wuhan, where wildlife was also traded illegally. The WHO also says an animal source appears most likely to be the primary source of the outbreak. Viral samples have been taken from patients and analyzed in the laboratory, and officials in China and the WHO have concluded the infection is a coronavirus. Scientists in China have been able to determine and document the genetic code of the new virus, leading to its positive identification as a new strain of coronavirus. Further research published by scientists from 5 Chinese universities presented a study of the genetic code of 2019 CoV, finding that it was distinct from but closely related to SARS-like coronavirus samples from bats. This means that 2019 CoV originated as a zoonotic virus, or one that was transmitted from animals to humans, but there is now evidence to suggest human-to-human transmission. According to the WHO, signs of infection include respiratory symptoms, fever, cough, shortness of breath and breathing difficulties. According to a report in the Journal of the American Medical Association, as many as 98% of COVID-19 patients have a fever, between 76% and 82% have a dry cough, and 11% to 44% report exhaustion and fatigue. In more severe cases, it can lead to pneumonia, severe acute respiratory syndrome, kidney failure and even death. Scientists with the MRC Centre for Global Infectious Disease Analysis at Imperial College in London warned in a paper published on Friday, January 17, 2020, that the number of cases in the city was likely to be closer to 1,700, much higher than the number officially identified. The new coronavirus strain first appeared in Wuhan in December 2020 and has already spread abroad, with 2 cases in Thailand and 1 in Japan.
80% of coronavirus cases and more than 95% of deaths from the virus are in Hebei province. It's because of human-to-human transmission.
On January 23, 2020, there is evidence of respiratory transmission of the virus from patient to patient, and Chinese authorities have also said 15 medical staff in the country have been infected. Experts particularly worry when health workers get sick during new outbreaks because this can suggest the disease is becoming more transmissible and because spread in hospitals can often amplify the epidemic. On Thursday, January 23, 2020, the WHO is expected to announce its decision on whether to declare a global public health emergency in relation to the new coronavirus. Chinese authorities effectively sealed off Wuhan on Thursday, January 23, 2020, suspending flights and trains out of the city and telling residents they could not leave without a special reason, state media said. Chinese authorities have stepped up monitoring and disinfection efforts ahead of the Lunar New Year break, which formally starts on Friday, January 24, 2020, and is when many of the country's 1.4 billion people will travel domestically and overseas. Airport authorities across Asia, including Japan, Hong Kong, Thailand, Singapore, South Korea and Malaysia, quickly stepped up screening of passengers from Wuhan. In Europe, the United Kingdom and Italy have said they will introduce enhanced monitoring of flights from Wuhan, while Romania and Russia are also strengthening checks. Some airports in the United States have also begun checks.